Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Nationwide, couple-based genetic carrier screening. Background. Genomic sequencing technology allows for identification of reproductive couples with an increased chance, as compared with that in the general population, of having a child with an autosomal recessive or X-linked genetic condition to conclusions. Couple-based reproductive genetic carrier screening was largely acceptable to participants, and was used to inform reproductive decision-making. The delivery of screening to a diverse and geographically dispersed population was feasible. The next article is Adjunctive middle meningeal artery embolization for subdural hematoma. Background. Subacute and chronic subdural hematomas are common and frequently recur after surgical evacuation. The effect of adjunctive middle meningeal artery embolization on the risk of reoperation remains unclear. Conclusions. Among patients with symptomatic subacute or chronic subdural hematoma with an indication for surgical evacuation, middle meningeal artery embolization plus surgery was associated with a lower risk of hematoma recurrence or progression leading to reoperation than surgery alone. Further study is needed to evaluate the safety of middle meningeal artery embolization in the management of subdural hematoma. The next article is Safety and Efficacy of Immunization with a Late Liver Stage Attenuated Malaria Parasite. Background. Currently licensed and approved malaria subunit vaccines provide modest, short-lived protection against malaria. Immunization with live attenuated Plasmodium falciparum malaria parasites is an alternative vaccination strategy that has potential to improve protection to conclusions. In this small trial, GA2 was associated with a favorable immune induction profile and protective efficacy, findings that warrant further evaluation. Next, we will be discussing articles from Journal of American Medical Association. Evaluating performance and agreement of coronary heart disease polygenic risk scores. Question is prediction of an individual's genetic risk for coronary heart disease, CHD, consistent across polygenic risk scores, PRSs, that perform equivalently at a population level? Findings: 46 scores with similar population-level performance produced discordant individual-level estimates of risk in the All of Us research program. 20% of participants had PRSs in both the top and bottom 5th percentile, at least once across the 46 nearly equivalent PRSs, meaning CHD PRSs with similar population-level performance characteristics may not provide consistent individual risk estimates. Personalized applications and clinical interpretations of CHD PRSs should consider the uncertainty of risk predictions at the individual level. The next article is Zerlasiran, a small interfering RNA targeting lipoprotein, a phase 2 randomized clinical trial. Question. What is the effect of Zerlasiran on time-averaged lipoprotein serum concentrations during 36 weeks of treatment? Findings in 178 patients with cardiovascular disease and lipoprotein, concentrations greater than or equal to 125 nmol/L. The least squares mean placebo-adjusted time-averaged percent change in lipoprotein serum concentrations was -85.6%, -82.8%, and -81.3% for the 450 mg every 24 weeks, 300 mg every 16 weeks, and 300 mg every 24 weeks groups, respectively. The most common adverse events were mild injection site reactions, meaning Zerlasiran was well tolerated and reduced time-averaged lipoprotein concentration by more than 80% during 36 weeks of treatment. Next, we will be discussing articles from Annals of Internal Medicine. The effect of Denosumab on risk for emergently treated hypocalcemia by stage of chronic kidney disease. Background. There is a paucity of data on treatment of osteoporosis in patients with advanced chronic kidney disease, CKD, Objective. To assess the risk for emergently treated hypocalcemia with Denosumab by stage of CKD, and presence of CKD mineral and bone disorder, CKD-MBD. Conclusion. Risk for emergently treated hypocalcemia with Denosumab increased with worsening CKD stage, and was highest in DD patients and those with CKD-MBD. Next we will be discussing articles from British Medical Journal. Nurse and doctor turnover and patient outcomes in NHS acute trusts in England. Objective 2. Investigate the association between monthly turnover rates of hospital nurses and senior doctors and patient health outcomes, mortality and unplanned hospital readmissions. Conclusions. Lower turnover rates for nurses and senior doctors at hospital level were associated with better health outcomes for patients with emergency hospital admissions. Next we will be discussing articles from Lancet. Induced pluripotent stem cell-derived corneal epithelium for transplant surgery, a single-arm, open-label, first-in-human interventional study in Japan. Background. The loss of corneal epithelial stem cells from the limbus at the edge of the cornea has severe consequences for vision, with the pathological manifestations of a limbal stem cell deficiency, LSCD, difficult to treat. Here, to the best of our knowledge, we report the world's first use of corneal epithelial cell sheets derived from human-induced pluripotent stem cells, iPSCs, to treat LSCD. Interpretation. ICEP's transplantation for LSCD was found to be safe throughout the study period. A larger clinical trial is planned to further investigate the efficacy of the procedure. Next we will be discussing articles in the field of hemato-oncology. Here are the articles from Cancer Journal for Clinicians. Efficacy and safety of nivolumab monotherapy in patients with unresectable clear cell sarcoma and alveolar soft part sarcoma. Background. Clear cell sarcoma, CCS, and alveolar soft part sarcoma, ASPS, are rare, and standard systemic therapy is not established except for sunitinib in ASPS. It is known that CCS and ASPS have a common biological feature of melanoma, and XP11.2/TFE3 translocation renal cell carcinoma and immune checkpoint inhibitors, ECs, are effective in these tumors. The authors conducted a phase 2 trial to evaluate the efficacy and safety of nivolumab for CCS and ASPS. Conclusions. The primary endpoint of the ORR was not met for CCS and ASPS on the central review. Further studies are needed to evaluate ECs in patients with ASPS. Here are the articles from Journal of Clinical Oncology. Trastuzumab deruxtecan in advanced solid tumors with human epidermal growth factor receptor 2 amplification identified by plasma cell-free DNA testing, a multi-center, single-arm, phase 2 basket trial. Purpose. Herald/Epic 1806 was conducted as a multi-center phase 2 trial assessing trastuzumab deruxtecan, TDD, therapy for patients with human epidermal growth factor receptor 2, HER2 amplified progressive stage solid tumors detected by cell-free DNA, cfDNA, testing. 5.8 to 11.2 months, respectively, with the majority of complications being mild to moderate. Interstitial lung diseases were identified in 26% patients, including 14 patients with grade 1 disease, 1 patient with grade 2 disease, and 1 patient with grade 3 disease. Conclusion. TDD treatment demonstrated high ORR with durable response in patients with advanced HER2 amplified solid tumors determined with cfDNA testing. Here are the articles from Journal of Hepatology. Sodium taurocholate cotransporting polypeptide, NTCP, polymorphisms may influence HDV RNA load and early response to bulevirtide. The impact of NTCP genetic variants on HDV RNA load and treatment response to BLV in CHD is unknown. Patients with CHD carrying NTCP RS175569115TT/CC compared to CT genotypes presented higher baseline HDV RNA load. Carriers of TT/CC compared to CT were more likely to show a viral non-response than a partial response at week 24 of BLV treatment. C greater than T genetic polymorphisms seem to affect baseline HDV RNA load and may help identify different patterns of early virological response to BLV. Next article is Hepatic venous pressure gradient predicts risk of hepatic decompensation and liver-related mortality in patients with MOSLD. HVPG measurement can identify patients with MOSLD cackled at risk of liver-related events. CSPH drives decompensation and liver-related death in MOSLD cackled. The risk of liver-related events in MOSLD cackled without CSPH is low. HVPG can facilitate risk stratification and treatment decisions in MOSLD cackled. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from gastroenterology. Molecular mechanisms underlying loss of vascular and epithelial integrity in irritable bowel syndrome. Background and aims. The pathophysiology of irritable bowel syndrome, IBS, is multifactorial and includes epithelial barrier dysfunction, a key element at the interface between the gut lumen and the deeper intestinal layers. Beneath the epithelial barrier, there is the vascular one representing the last barrier to avoid luminal antigen dissemination. The aims of this study were to correlate morphofunctional aspects of epithelial and vascular barriers with symptom perception in IBS conclusions. Epithelial and vascular barriers are compromised in patients with IBS and contribute to clinical manifestations. Here are the articles from Clinical Gastroenterology. Prevalence and determinants of liver disease in relatives of Italian patients with advanced MOSLD. Background and aims. Metabolic dysfunction-associated steatotic liver disease, MOSLD, has a strong genetic component. The aim of this study was to examine non-invasively the prevalence of MOSLD and of advanced fibrosis in relatives of patients with advanced MOSLD and the risk factors for liver involvement, with a focus on the contribution of common genetic risk variants. Conclusions. We confirmed that about 1 in 7 relatives of patients with advanced MOSLD has advanced fibrosis, supporting clinical recommendations to perform family screening in this setting. Genetic risk variants contributed to liver disease within families, but did not meaningfully improve fibrosis risk stratification. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Prevalence, clinical severity and serotype distribution of pneumococcal pneumonia among adults hospitalized with community-acquired pneumonia in Tennessee and Georgia, 2018 to 2022. Introduction. Understanding the pneumococcal serotypes causing community-acquired pneumonia, CAP, is essential for evaluating the impact of pneumococcal vaccines. Conclusions. Approximately 12% of adults hospitalized with CAP had S. pneumoniae detected, and approximately 1/3 of the detected pneumococcal serotypes were not contained in PCV15 or PCV20. Development of new pneumococcal vaccines with expanded serotype coverage has the potential to prevent a substantial burden of disease. Next, we will be discussing articles in the field of rheumatology. Circulating adipokines and response to treatment in patients with early rheumatoid arthritis. Objective. The objective of this study was to determine if baseline adiponectin, leptin, and resistin levels are associated with response to antirheumatic treatment in early rheumatoid arthritis, RA. Conclusion. Baseline adiponectin, leptin, and resistin levels are not associated with the likelihood of achieving C-day remission over 48 weeks of treatment in a large cohort of people with untreated early RA. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Prevalence and clinical implications of autoantibodies in juvenile dermatomyositis. A single-center experience from India. Objective. This study aimed to characterize the profile of myositis-specific and myositis-associated autoantibodies, MSAS/MAS, in an Indian cohort of juvenile dermatomyositis, JDM, patients and correlate them with clinical features and outcomes. Conclusions. MSAS/MAS were identified in 81% of children with JDM in our study, which is higher than most other studies. The most frequently observed antibodies displayed a pattern consistent with other studies. Anti-TIF1 gamma was associated with a younger age at onset and disease flares even after attaining a complete clinical response. Anti-NXP2 had higher odds of severe muscular weakness. These observations suggest consistency in certain phenotypic associations observed across geographic boundaries. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Single-cell RNA sequencing reveals metabolic stress-dependent activation of cardiac macrophages in a model of dyslipidemia-induced diastolic dysfunction. Background. Metabolic distress is often associated with heart failure with preserved ejection fraction, FPEF, and represents a therapeutic challenge. Metabolism-induced systemic inflammation links comorbidities with FPEF. How metabolic changes affect myocardial inflammation in the context of FPF is not known. Using single-cell RNA sequencing in a model of diastolic dysfunction driven by hyperlipidemia, we have determined the effects of metabolic distress on cardiac inflammatory cells, in particular on macrophages, and suggest sodium-glucose cotransporter 2 inhibitors as potential therapeutic agents for the targeting of a specific phenotype of HFpEF. Here are the articles from Journals of the American College of Cardiology. Complete versus culprit-only revascularization in older patients with myocardial infarction with or without ST segment elevation. Background. The effectiveness of complete revascularization is well established in patients with ST segment elevation myocardial infarction, STEMI, but it is less investigated in those with non-ST segment elevation myocardial infarction, and STEMI, objectives. This study aimed to assess whether complete revascularization, compared with culprit-only revascularization, was associated with consistent outcomes in older patients with STEMI and NSTEMI. Conclusions. Physiology-guided complete revascularization, compared with culprit-only revascularization, provided consistent benefit across the whole spectrum of patients with MI. From Jamis-Frey, Cardiology Varenicline plus allopurinol for heart failure with preserved ejection fraction. The Amethyst randomized clinical trial. Question. What are the effects of Varenicline, a novel urate transporter 1 inhibitor, on exercise capacity and symptoms in patients with heart failure with preserved ejection fraction, HFpEF, and elevated serum uric acid, SUA, level? Findings in this randomized clinical trial including 159 patients. The combination of Varenicline and allopurinol compared with allopurinol alone or placebo resulted in significantly greater reduction in SUA level after 32 weeks of treatment. However, it did not significantly improve peak oxygen uptake, symptoms, or key echocardiographic parameters in patients with FF and elevated SUA level, meaning combining Varenicline with allopurinol to lower SUA level did not improve peak oxygen uptake or symptoms in FPFF. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Hemostatic effects of exercise-related hypoglycemia in male persons with type 1 diabetes. Context. People with type 1 diabetes, T1D, are at increased risk of thrombosis compared to the general population. However, the underlying mechanisms remain unclear. Hypoglycemia induced at rest can induce coagulation activation, but little is known about the hemostatic effects of exercise-related hypoglycemia in people with T1D. We compared hemostatic profiles of individuals with T1D with healthy controls and explored hemostatic effects of hypoglycemia, induced with or without exercise, in participants with T1D. Conclusion. Individuals with T1D exhibit a hypercoagulable hemostatic profile compared with healthy controls, and exercise-related hypoglycemia may increase the susceptibility to thrombosis via both procoagulant and antifibrinolytic effects. Here are the articles from Diabetes Care. Trends in racial and ethnic disparities in early glycemic control among veterans receiving care in the Veterans Health Administration, 2008 to 2019. Objective: racial and ethnic disparities in glycemic control among non-Hispanic Black, NHB, and non-Hispanic White, NHW, veterans with type 2 diabetes, T2D, have been reported. This study examined trends in early glycemic control by race and ethnicity to understand how disparities soon after T2D diagnosis have changed between 2008 and 2019 among cohorts of U.S. veterans with newly diagnosed T2D. See inclusions. Overall, early glycemic control trends among veterans with newly diagnosed T2D have been stable since 2008, but trends differed by racial and ethnic groups, and disparities in very poor glycemic control were still observed. Efforts should continue to minimize disparities among racial and ethnic groups. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Quantitative MRI measures and cognitive function in people with drug-resistant juvenile myoclonic epilepsy. Background and objectives. Neuroimaging studies have so far identified structural changes in individuals with juvenile myoclonic epilepsy, JME, when compared with controls. However, the underlying mechanisms of drug-resistant JME remain unknown. In this study, we aimed at characterizing the structural underpinnings of drug-resistant JME using MRI-derived cortical morphologic markers. Discussion. We identified a developmental phenotype in individuals with drug-resistant JME characterized by changes in cortical surface area and folding complexity, the extent of which correlates with executive dysfunction. No association was observed between cortical thickness and disease severity. Our findings support a neurodevelopmental basis for drug resistance and cognitive impairment in JME. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Air pollution metabolomic signatures and chronic respiratory diseases risk. A longitudinal study. Background. Although evidence has documented the associations of ambient air pollution with chronic respiratory diseases, CRDs, and lung function, the underlying metabolic mechanisms remain largely unclear. Research question. How does the metabolomic signature for air pollution relate to CRD risk, respiratory symptoms, and lung function? Interpretation. Our study identifies metabolomic signatures for air pollution exposure. The metabolomic signatures showed significant associations with CRD risk, and inflammatory and erythrocyte-related markers partly mediated the metabolomic signatures' CRD links. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Lung protective mechanical ventilation in patients with severe acute brain injury. A multicenter randomized clinical trial. Prolabi rationale. Lung protective strategies using low Vermont and moderate positive end expiratory pressure, PEEP, are considered best practice in critical care, but interventional trials have never been conducted in patients with acute brain injuries because of concerns about carbon dioxide control and the effect of PP on cerebral hemodynamics. Objectives. To test the hypothesis that ventilation with lower VT and higher PP compared to conventional ventilation would improve clinical outcomes in patients with acute brain injury. Conclusions. In patients with acute brain injury without ARDS, a lung protective ventilatory strategy, as compared with a conventional strategy, did not reduce mortality, percentage of patients weaned from mechanical ventilation, or incidence of ARDS, and was not beneficial in terms of neurological outcomes. Because of the early termination, these preliminary results require confirmation in larger trials. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Physical function and mortality in older adults with chronic kidney disease. Key points. Using data from the chronic renal insufficiency cohort study, we found that death in older adults with CKD is associated with 1. Slow walking speed and 2. Frailty. The elevated risk of death with slow walking speed or frailty persisted even if kidney failure with replacement therapy was pursued. When older adults with CKD and their families face treatment decisions, clinicians should utilize walking speed to frame discussions of prognosis. Here are the articles from Kidney International Reports. Associations of urine epidermal growth factor with kidney and cardiovascular outcomes in individuals with CKD in SPRINT. Introduction. Urine epidermal growth factor, UEGF, has been found to be inversely associated with kidney function loss, whereas its associations with cardiovascular disease, CVD, and mortality have not been studied. Conclusion. Among hypertensive adults with chronic kidney disease, CKD, lower baseline UAGV concentration was associated with faster eGFR decline independent of baseline albuminuria and eGFR, but not with ESKD, AKI, CVD, and all-cause mortality.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.